Hi everyone, welcome back to TYP. It's me, Megan, again. I just got back from a big resaging appointment. That's my once every 3 months big appointment where I get my scans. I get those reviewed with my oncology team, and then we move forward with next steps. So I just came back from that today, and it wasn't great. So I just wanted to give an update on my cancer journey for those of you that follow that, for those of you that are curious. So that's why I wanted to talk to you about today. It wasn't a great appointment. Essentially, yesterday I went in and I get MRIs because that's the best way to see my cancer, to see my bile duct cancer, and to see exactly what's going on in my liver. I also get a CT scan of my chest, because that's the best way to see what's happening in my lungs, because I do have some spots in my lungs and my lymph nodes that show up on CT scans. So I went in yesterday, got my CT scan. That was easy. Got into the MRI machine, and I get pretty much full body MRIs. They're from base of skull to tailbone. So those take about 45 minutes to an hour. And yesterday they were having trouble getting good pictures. I'm not sure why. The first time they said something was some kind of anomaly, not in me, but something popped up in the pictures, like a weird spot that they couldn't get rid of. So they had to redo a lot of my scans. So I was in the MRI machine for about an hour and 20 minutes, which was rough. I actually had to stop after an hour and ask them if I could take a break. Because I was sitting there with my arms over my head, and I was losing feeling in my shoulder and my arms from being like that in that tight tube for an hour. And after that, just after I had the break, I did not want to go back in that tube. It was rough, but I did it. I made it through. I was really, I felt like I was very like wiggly and jittery in the MRI machine, and you're supposed to be as still as possible so they could get great pictures. But it turned out fine. They were able to get what they needed. So that was yesterday. And then this morning I went in early. And usually usually when I go in on doctor appointment days, I go in early and I get blood work done. You can see I've got a Band-Aid over my port here. And it's all red, from the adhesive. Then I go see my oncology team. They tell me what's going on based a lot on my blood work. And then after that is usually chemo. So I went in, met with my, primary oncologist, and he came right out. He said, so we've been looking at your MRI, and you have some regrowth. And I had some regrowth on my last scan, and that's why we added cisplatin back onto my chemo regimen. And we were under the impression that adding cisplatin back onto my chemo, because I had just been on gemcitabine before that. So with the combo gemcitabine, cisplatin, that would knock out and stop the new growth. My cancer has a BRCA2 mutation, and a lot of studies show that cisplatin is very good at dealing with BRCA type cancers. And that's what I was on when I was first diagnosed, and it did a really good job. So this time around, we thought it would do a great job and at least stop the cancer. That didn't happen this time, unfortunately. So I had some regrowth. They said not in my lungs, but in my liver, where my cancer is primarily based, there was regrowth. I had some growing tumors, which is, I've had some more pain here recently, which is kind of a symptom of regrowth for me. But I kind of thought that was coming, but I was really hoping that it wasn't, that wasn't actually the case. You know. So I went into that appointment, kind of left a little bit bummed. I didn't get chemo. He said, it's not working. I don't see the point of just keeping you on it to keep you on it. So you'll get a break. I'm on my first chemo holiday. This is my first chemo holiday in almost 2 years of treatment. So we'll see what it's like. So it'll be, at the end of this, it'll be a month that I've missed chemo. And we'll see how I feel. We'll see if my skin clears up. I've been having trouble retaining a lot of fluid. So hopefully some of it will work itself out because of this chemo holiday. So I'm kind of excited to see if some of my side effects kind of diminish. And he doesn't think that my cancer is just going to explode during this holiday. It'll just be a nice break. So that's good. That's at least comforting. So no chemo today, kind of a bummer. But we have next steps, right? Because that's always what happens. And, chemo protocols fail. And if you're somebody with advanced cancer or somebody getting chemotherapy for something else long term, this is kind of what happens, unfortunately. Some people are really lucky and they go in, they get chemo for 3 to 6 months. It does its job. Their cancer's gone. They're in remission. And that's it. Some of us aren't so lucky, and we've got to be on chemo sometimes for the rest of our lives. And when that happens, your body just gets used to things. So even things like my cisplatin gemcitabine combination that worked really well before, my body's just getting used to it because I've been on chemotherapy for 2 years. My body's starting to adapt, evolve almost to tolerate chemotherapy, and my cancer is evolving to tolerate the chemotherapy. So that's what happens when protocols fail. And then you've got to move on to a new protocol, and then you're just always hoping and praying that that protocol works. So hopefully the next one will. So the next step for me is my doctor's trying to get me on a drug called a PARP inhibitor, PARP, which stands for something very long. It's like poly something amino ribase. I don't know. It's very long. But PARP inhibitors are used very often in people with pancreatic cancer. And it's kind of a long-term oral chemotherapy drug, or a long-term drug that you can take. That basically helps people with advanced illnesses live longer lives. So the PARP inhibitor that they are trying to get me on, they've been trying to get me on for months now, is called olaparib, OLAPARIB, olaparib. And it's not approved for bile duct cancer, not approved for cholangiocarcinoma. It is approved for pancreatic cancer, and some other type of cancers. But there's a lot of there's some research that kind of points to it being very helpful for people with bile duct cancers, with cholangiocarcinomas and other biliary tract cancers like I have. Especially people with BRCA2 mutations, which my cancer has a BRCA2 mutation. So we've been trying to get on it. My insurance won't cover it. And it's one of those drugs that out of pocket's $15,000 a month, $15,000 to $20,000. So paying for it out of pocket without insurance help is just out of the question, unfortunately. So we've tried other avenues, tried reaching out to AstraZeneca, who makes Lynparza, which is the brand name of olaparib. Financially, they can't help me at all. But my doctor is trying to apply for what they call compassionate care for me, to see if they can give me olaparib for free or reduced cost because of my circumstances, because of my advanced cancer diagnosis, essentially because it makes them look better. It makes them look like like they care about their patients, essentially. So hopefully that avenue works and I can be on a PARP inhibitor. And, hopefully that works like my doctor will think it works. He said that he has some pancreatic cancer patients that have been on PARP inhibitors for about like 10 years, which is a really big deal because pancreatic cancers are nasty cancers. And if they're advanced, your life expectancy is not great. But if PARP inhibitors can do for what they do to pancreatic cancer patients, we'd be in really good shape, right? Another option is there is a clinical trial that I'm trying to get into, and it's based in Washington, D.C. It's out of Georgetown, and it's a clinical trial for the use of olaparib and I'm going to butcher this, pembrolizumab, which some people might know as Keytruda, which is an immunotherapy. And it's a study for people with bile duct cancer to give them this PARP inhibitor and this immunotherapy to see how it will do. And I qualify medically, it looks like I qualify for the study. So we're trying to get in on that. I tried reaching out to Georgetown myself and haven't been able to get an answer from several people. So once again, my doctor, because he is an amazing person, he's a great, great doctor, and he's an advocate for me every step of the way. So once again, he is stepping in to try and contact the doctor that's the head of that study and see if I can get in there right away. I may be going down to Washington, D.C. For a while, back and forth, which isn't close, but it's not terribly far away. But, when it comes to stuff like this, when it comes to prolonging your life because you can get on a certain type of drug, I feel like there's no alternative, right? If I have to travel to do it, then so be it. We work it out. We figure it out, right? So fingers crossed that some of that comes through for me. And if all of the PARP inhibitors in the clinical trials don't come to fruition, my next plan is a change of chemo. And what I would most likely go on as a next step, if I can't get approved for any PARP inhibitors and can't get into that trial, is to start on a combination chemotherapy called FOLFOX. FOLFOX is a newly approved, I think within the last year or so, newly FDA approved to treat cholangiocarcinoma and biliary tract cancers for people like me, which is nice. The more options we have, the better, because like I said, if you're on chemotherapy long term, this is stuff that happens. You're on a protocol, your body gets used to it, that protocol fails, you got to move on to a new protocol. So we would try FOLFOX next. And FOLFOX actually is a combination of folinic acid, fluorouracil, I don't know if I'm saying that right, and oxaliplatin, which is a cousin of cisplatin, which is what I was on until very recently. And it doesn't work as well typically as the GEM-CIS combination for cholangiocarcinoma, but can still work very well. and is a good second line therapy when you need it. The hang up with Folfox is oxaliplatin. So oxaliplatin comes with some serious side effects. The worst one is neuropathy in your hands and feet specifically. And what happens is that for like 2 or 3 days after you get oxaliplatin, you can't touch, handle, drink, eat anything cold. I've heard people will drink a glass of ice water after receiving oxaliplatin, and it feels like they're swallowing shards of glass. And that's a bit like you can't reach into the refrigerator without gloves on. You can't walk across like a cold floor in the morning without slippers on. In the winter, you've got to stay covered 100% of the time. No cold air blowing on you. And side effects, they say, usually lessen after a few days, after 2 or 3 days after you receive treatment. But it's one of those things, the longer you receive it, the longer those side effects happen to you. So if you've been receiving Folfox for 8 weeks or something like that, maybe you can't drink ice water for a full week or something like that, or can't touch anything cold for a full week. But the alternative is not doing it. So we kind of just tough it out and deal with the symptoms, right? And eventually people on Folfox get, it's not something you can be on for months and months or years or something like that, because usually just the neuropathy gets so bad. Like you can't feel your feet anymore, and therefore you can't drive, or, you can't walk down the street because you keep losing your balance because you can't feel your feet, that kind of a thing. So when that happens, you stop. And then you've got to find a new treatment protocol after that. But that's kind of what's in store for me, Folfox. And Folfox is administered differently too than Gemcis and most chemotherapies. So this would be a whole new world for me too if I were to be on Folfox. So I've heard that what they do is, I guess, I go in, get my blood work taken. If I pass, I would go into the infusion room and get an infusion of oxaliplatin. And then what they do is administer the fluorouracil and the folinic acid over 3 days. So from what I understand, my doctor said that they would attach a tube from my port access down to like a fanny pack that I have to wear. I have to wear a fanny pack around from Wednesday till Friday. And that would have the folinic acid and the fluorouracil in it. And yeah, I'd be getting that over the course of 3 days in doses. And then on Friday, I go back into the hospital. They would de-access my port, clean everything out, and make sure I didn't need fluids or anything like that. And then probably eventually I would learn to do that myself. I would learn how to de-access my own port. So if that happens, I will show you guys. I will give you, I'll show you what life is like on Folfox and discuss the ins and outs of that. So we'll see. Those are my options. So it's either clinical trial, get myself on a PARP inhibitor somehow, some way, if somebody comes through for me with that, or start Folfox treatment, which is our next line chemotherapy. So, when stuff like this happens, I always talk about how to remain positive. But, when you go to the doctors and you get bad news, no one wants to hear that their cancer is progressing and that their current protocol is not working. It's not great. And And I would be lying if I say I wasn't bummed out today, because I am. I'm disappointed. I'm a little sad. And I know tomorrow I will wake up and I will reset my mindset and I will just move forward, because we really don't have a choice. If I want to be here and I want to stay here as long as possible so that I can be around for my nieces and nephews, and be around for my family and enjoy life as much as I can, I want to stay here for as long as I can. So I really have no choice but to keep going and to move forward and to do everything I can to try and get better. But today I'm sad. I'm bummed out. I'm disappointed. You could probably see it in my eyes now, just thinking about it. It makes me a little bit upset, because it's one of those things. It's like, I was doing well. I was stable for almost a year. And when I wasn't stable anymore, I knew it was coming. It wasn't a big deal. We were going to go back on this protocol. It was probably going to work, and things were going to be okay. And then that protocol didn't work. It failed, and it should have worked for me. Um, so that's it. And it's one of those things where I always, in the back of my head, it's like a ticker tape. I always know that I have cancer. It's always the thing that's in the back of my head. I never forget that. But I do, not that I forget that it's, terminal, or my prognosis isn't remission. But when stuff like this happens, when you hear your cancer is growing, or you're no longer in remission, or your disease is progressing, it's kind of another knock on the door saying, it's a reminder that it's like tick, tick, tick. The clock on your life is running. And you thought you had this amount of time, and you might not. It might be a little bit shorter, or a lot shorter. And that can be hard to deal with sometimes. It can. And that's the part that I tend to forget. The terminal part. Because let's be honest, a lot of us are out there dealing with an advanced illness, and you're just hoping, you're just always secretly hoping that you live long enough that somebody finds a cure, or somebody finds a treatment that's going to work for you, or some immunotherapy breakthrough is going to happen that can work for you. Just because we're terminal, or our prognosis isn't remission, or what have you, doesn't mean that we don't have hope for the future, because we do. A lot of us do. But just those reminders, or those things that smack you in the face and remind you that life is short, and your life might be shorter than most. They're rough sometimes. They are. So I got back from my appointment, talked about it with my husband, told my family. My mom was sad. She was kind of bummed that it was bad news. And I think that's kind of the hardest part for me, is telling my family that it was bad news. But we have options still. I still have options. And I'm still moving forward with those options. And we're still going to fight as hard as we can to find answers and to live as long as we can, so that we can be there for our friends and family. And that's all we can do. So I committed to not giving up, and I'm going to move forward. But today I'm just a little sad, and I think that's okay. We've got to sit there and deal with our feelings sometimes. And then tomorrow I will wake up and I'll be committed to moving forward and fighting to, prolong my life and fight to find something that's going to work for me. So that's the update. That's what's happening in my life lately. And I'm sure in a couple of weeks I will have more information to update you with. But this is it. This is the face of advanced illness. This is the face of terminal cancer. And sometimes it's not pretty. And sometimes it's sad. But that's life, right? So, everybody, thanks for hanging in there with me. I hope you're having a good day. I do. I hope you're having a better day. Or if you're not having a good day, I hope tomorrow is a better day for you. And go do something nice for yourself. And I will talk to you all soon. And thanks for hanging in there with me. And thank you so much for your words of encouragement and positivity. It's been a busy time, so I haven't been able to comment on everybody's comments and questions yet on YouTube. But I'm trying to read as many of them as possible. And some of you leave me such great, positive, uplifting messages and some really good advice. And I really appreciate that. You really helped me. Everybody that's watching this, you helped me a lot. And I hope that I help you as well. So thanks again. And I will talk to everybody soon. Bye.